So people like to think that your health is solely your responsibility, and nah, in my Delta Slim voice. Like, I didn't sound like him at all, but that's what I thought in my head. And here's why. And that definition itself, in terms of healthism, really being this preoccupation with one's health, coming from Robert Crawford in 1980. And yes, we are still experiencing this now, and it's really mainstream, and it can be harmful and toxic and can induce shame and all the things. But what if I don't have access to healthy food? What if I can't afford a gym membership? What if you want me to go walk, but if I go outside, there is a big possibility that I might get robbed. I might not actually have a green space to walk in. My neighborhood might not be designed in such a way that there are sidewalks so that I can safely maneuver and be able to get to point A or point B. If you're telling me that I need to be able to meal prep and eat healthy food, well, what if I don't work a stable job, or what if I work nights and then I just got my medication adjusted, and I could keep going. I could keep going. So these are reflections of systems, and also in many instances racism, because the design and the actual development of areas was designed to keep Black people out of certain neighborhoods, keep them away from having access to certain things. Urban development is the term that I was thinking of, but I could not get it to come to the forefront of my brain. But there are so many things that are unfortunately rooted in racism that play a role and impact all of us. And one of the things that often shows up when I am meeting someone for the first time with a consult is I just ask them, tell me about your day to day. When you want to exercise, talk to me about that. And in a lot of these conversations, people might have access to a gym. They might be able to eat healthy, but then as they continue to talk, you very quickly realize they don't have time to do all of these quote unquote healthy things. And social media does not help, because they're like, well, I can't meal prep all 8 of my meals a week, or I can't cook at home because I have children, or I have a very intensive job, or I travel, or I can't afford it, or insert all of the things that happen to real people every single day that prevent them from this so-called healthy lifestyle. And this is why I started our conversation talking about those systems, talking about how the history of all of these things have shaped our country. And now I'm going to start talking to you about how it shows up. And I'll give you another example, even 2 more examples. One, talking to my mom. The doctor's telling her your blood pressure is getting high. You need to be able to go out and walk. In her neighborhood, she cannot do that. It is not safe for her to do that. And she also has fibromyalgia, and now she's had a knee replacement and all these other things. She doesn't have the endurance to be able to do that either. Or she was also told you need to start eating better, you need to start eating more fruits and vegetables, or all these things. But there is no grocery store that is close to her. And she does not have a reliable mode of transportation. So now what? I've sent meal delivery services, but my mother's a very picky eater, and she wouldn't eat 90% of the stuff in there, even though we would sit down together and choose the items in her upcoming meal. She didn't like any of the things. So for her, it would be much better for her to be able to go and choose those options. But the closest grocery store to her is at least 20 minutes away, driving. Then, when I was initially figuring out what was going on with my thyroid disease, for example, I started to finally feel better, and I wanted to work with a personal trainer. And one of the first things that he said was, I could get you off your medication. What? No, you can't. That's dangerous. And that is also a reminder for health and wellness professionals and personal trainers, especially, and nutrition coaches, especially, stay within your scope of practice. And this man also had me trying to jump on these blocks and do all this high intensity interval training. And I was literally in a flare all the time. And he would often say to me, you're not working hard enough, you don't want it. Bro, get that internalized ableism on somewhere. You're not going to guilt and shame me with that type of stuff. And I'm not about to try to push myself to do that, because I won't be able to walk tomorrow. I won't. Did I sometimes feel bad that I wasn't pushing myself? Yes. But at the same time, it is really important to find people that you can work with and that will work with you, who understand this concept. So it's also really important from an advocacy perspective that when you are seeking assistance or help or anything related to your health from a medical professional, especially, there is something within the electronic medical record, for example, that when you're talking to them and they're documenting in the chart, it populates this social determinants of health wheel. I'm not sure if it does it for all EMRs, but the one that I work with, it does. And as you're filling out your responses, what happens is, if you are struggling with food security, it'll light that up. If you are not able to get to your appointments and you're having more conversations and you've been a no-show and they actually talk to you about it, those things start to show up within that wheel. And what can happen is that would help to get you connected with, let's say, a social worker or a community health worker that can point you to the necessary services that you need. One of the services that I have seen many clinicians in my organization use is something called Find Health, or Aunt Bertha. and you can put your zip code in, which is what I'm currently doing now, and it shows you all of the various programs that you could potentially get help with, from food, housing, goods, transit, health, money, care, education, work, and legal help. So I'm telling you this because that is a system that you might be able to find out more information about. And also at your public library, I know right now I'm in a digital health navigator certification program, and I can direct individuals to the Maryland government websites for various services like this as well. They also have people who might work in social work that could be considered a health navigator that would be able to support you with filling out this information in these forms, or let's say you need social services or a social worker or some type of help. That is another reason why your library is chef's kiss. So I weaved in a lot of things in there, but you're going to get some action packed examples. And if you are a wellness professional or a provider, this is going to be really important for you too, because I really want to give various examples of even how I, in my many hats that I wear, can offer support, and where I know that my scope ends, and how I work to advocate with and for others, or show them how to do that, to make those healthcare visits with you run a little smoother. So this is also going to be a very fun series. And if you have not already looked at my course, The Medicine is in the Story, or A Teaspoon of Medicine, highly recommend you do.